Welcome to our conference session titled Living Well with Bone Marrow Failure Disease. Thank you for joining us. My name is Lee Clark, Director of Patient Services, and I'll be moderating the presentation today. As we get started, I'd like to recognize the generosity of our corporate sponsors and the generous support of our patients, families, and caregivers for supporting the conference today. Immediately following the presentation, there will be a question and answer session. Please feel free to submit your questions at any time during the presentation from the Q&A icon in the engagement panel on your right. To submit a question or comment, type your question or comment in the Q&A text box window, and when you have finished typing, just hit enter. We'll do our best to get to everyone's questions today. When asking questions, I do ask that you do two things to help me manage the incoming questions. First, submit your entire question all at the same time. Second, please do not share private health information in your question. Our speaker cannot answer any specific questions related to your personal health care. Our specialist today is Krisstina Gowin. Dr. Gowin is an associate professor of medicine at the University of Arizona. She graduated from the Chicago College of Osteopathic Medicine in 2009, where she received a merit scholarship and recognition from the American Women's Medical Association for outstanding academic achievement. Dr. Gowin completed an internal medicine residency at the University of Southern California, hematology and medical oncology training at the Mayo Clinic in Arizona, fellowship training in integrative medicine at the University of Arizona. She is board certified in medical oncology, internal medicine, and hematology. Dr. Gowin is passionate about integrative medicine and is committed to supporting patients through their journey. With all that said, it's my extreme pleasure to welcome Dr. Gowin.
My goodness, well, thank you for that wonderful introduction. And thank you so much to the Aplastic Anemia MDS International Foundation for sponsoring this program and giving the opportunity for us all to come together and talk about this important topic. So today I'm going to be talking about what are strategies to live well amidst your diagnosis. And so I'd like to invite you to think about, what does living well truly mean to you? What does that really embody for you when you think about living well? And so I'd like to take a moment for you just to close your eyes and imagine you in yourself as you are now, living your best life. How do you feel? What are some of the things that you're doing and incorporating in your life? And so just take a moment to kind of visualize, what is your best self? What does that look like? And that's really what we're aiming for. That's your goal. And I think it's a powerful practice to really have that mental imagery of what your best self truly is. And so with bone marrow failure, you're dealing with things such as side effects from your treatments, symptoms from the disease itself, and burdens such as transfusions. And sometimes that can truly feel, with all of that you're dealing with, that you're underwater. And it's hard to kind of catch your breath amidst all that you're really trying to navigate. And so what I'd like to do is to give you this life preserver, some wellness tools to hopefully bob up above this kind of underwater space, above the surface, where you can catch your breath and really start feeling empowered towards moving forward. So what are some of our objectives today? We're going to discuss what is integrative oncology, to discover why integrative care is important, to review some of the lifestyle medicine interventions that we know are efficacious, and to truly emphasize the care of the mind, to promote meaning and to foster joy within your life. And finally, to consider some complementary care modalities to really augment your journey. So let's start off with a definition. And what is the definition of integrative oncology? Integrative oncology is a patient-centered, evidence-informed field of cancer care that utilizes mind-body practices, natural products, and lifestyle modifications from different traditions alongside conventional cancer treatments. And that's truly what differentiates integrative care from alternative or complementary care, is that it's truly integrated. It's alongside, it is not instead of. Integrative oncology aims to optimize health, quality of life, and clinical outcomes across the cancer care continuum. And I love this, to empower people, you, to prevent cancer and become active participants before, importantly, during, and beyond cancer treatment. So if I were meeting all of you in the clinic, this is really how I begin the conversation. And it's really the 4 pillars of wellness. And so what are those 4 pillars? And it's care of the body, care of the mind, fostering joy and meaning. But you can see this is all surrounding really what binds it all together is conventional medicine, allopathic, osteopathic care, really fantastic hematologic care with your hematologist. And then we start to truly support the model, right? With all of this wonderful lifestyle medicine, mind-body medicine, as well as complementary modalities. And in this model, in conjunction with your traditional team, you have the power to start promoting your own wellness. So why is it so important to be thinking about this kind of model? We know that you, with bone marrow failure, likely have some unmet symptom needs. There's the need to decrease inflammation, and we'll talk more about inflammation. We know that inflammation is such an important driver of the disease itself, but also the symptoms that are manifesting amidst therapy. We know that there's a desire and already a current use of complementary approaches. There is the potential to impact your outcomes and decrease treatment toxicity, and the potential to decrease cost of care. And we call that financial toxicity, which is very important to consider as well. So let's jump into this idea of inflammation. And on the right-hand side of the screen, you'll see all of the things that really make a cancer cell and disease process truly cancer, all of these different mechanisms. But inherent within these mechanisms, embedded within, is tumor-promoting inflammation. And this is from Hallmarks of Cancer, which was Hanahan and Weinberg back in 2011. And there still has not been a paper that has rivaled this paper. This is a wonderful paper about the pathogenesis of cancer. And in that, again, they highlight tumor-promoting inflammation. And so what are some drivers of this inflammation? Chronic infections, obesity, smoking, alcohol, environmental pollutants, high-fat diets, and there's more. But all of these are known to be major risk factors for common types of cancer and are linked to cancer through the biology of inflammation. And so what strikes me when I read this is that many of these things, all of these things, to some degree, are modifiable by us. We can change these things and modify this risk. And we see it disease after disease after disease, that it's really inflammation that's driving the formation of cancer, in conjunction certainly with other factors. But inflammation, again, is a potent driver. And we see this in myeloproliferative neoplasms. We know that inflammation that's measured through high sensitivity CRP, C-reactive protein, really correlates with some of the outcomes we see in myeloproliferative neoplasms. We see increased risk of major thrombotic events with higher CRP levels. We see shortened leukemia-free survival, so a shortened period of time of when MPN's diagnosed to when actual acute myeloid leukemia manifests. And so those are very potent papers that describe inflammation tied to outcomes. We also see a similar pattern in myelodysplastic syndrome. And we know that it is contributing to all of the pathogenesis of the formation and the propagation of MDS as well. And this was recently published just last month in Cell Stem Cell, a really wonderful journal about how inflammation may actually promote transformation in leukemia. And so it behooves us to really think about how can we begin to quiet this inflammation? What can we do? How can we empower our journey towards this anti-inflammatory kind of bloodstream? And so lifestyle, right, is one of the most potent ways in which we can modulate the inflammation within our bodies. And this is truly the background of integrative health. We know that diet and exercise are potent modulators of inflammation. And so I like to give this visual in that with integrative medicine, what we're trying to do is to nurture your garden. And what do I mean by that? Imagining that you are a garden and your disease, whether that be aplastic anemia, whether it be NPN, MDS, is like a weed in the garden, and we need allopathic and conventional medication techniques to weed out the garden, right? To take out some of that disease, to control the disease. But we also need other mechanisms to truly go in and nurture the garden, nurture the soil, and make it inhospitable for new weeds, new cancer to grow, but also just to promote health and wellness and for a healthy garden to grow. And so one of the best ways to do that, again, is through nutrition and food choices. And Hippocrates, the father of medicine, said this early on in our medicine history: let food be thy medicine and medicine be thy food. And there is significant data to support this, that a anti-inflammatory diet, and one of the best anti-inflammatory diets truly is a Mediterranean diet, can change the biochemistry of the blood and actually impact survival. And so this is one of the largest studies done within the nutritional domain, in which over 7,000 high-risk cardiovascular disease patients were randomized and looked at those that were eating a high quartile, meaning choosing many of the foods which are in the Mediterranean diet and known to be anti-inflammatory, and then also supplementing that with either extra virgin olive oil or exogenous nuts, because we know nuts also have very good nutrient profile as well as fatty acid profile. And you can see in the green curve, those that were eating the highest quartiles of the Mediterranean diet had the lowest incident of cardiovascular endpoints. So what does that mean? Did they have a heart attack or did they die? And so those that were eating the most of the Mediterranean diet foods had a lower incidence of heart attacks and cardiovascular death. And why do we think that is? And they did some correlative studies looking at the impacts of inflammatory biomarkers, such as we had mentioned previously, high sensitivity CRP and other inflammatory markers. And those, again, that were eating the highest quartiles of Mediterranean foods had lower inflammatory blood biomarkers. And so I think this is, again, one of our most robust data sets showing that diet can impact the bloodstream and can impact inflammation. Clearly, we need more studies, and particularly within the hematologic space. There are other studies within breast, prostate, lung, but I think we can certainly translate some of what we see from the cardiovascular disease research into what we can anticipate to see in hematologic disease populations. When I see patients in the clinic, because I work here at the University of Arizona, disclaimer, and I have gone through the Andrew Weil Center of Integrative Medicine Fellowship here. This is the anti-inflammatory food pyramid in which we share. And actually, you can really see that it's very similar to the Mediterranean diet. Lots of omega-3 fatty acids, lots of fruits and vegetables, more vegetables than fruit, whole grains, healthy fatty foods. So I think, Mediterranean anti-inflammatory, they're very, very similar. A couple of tweaks within the University of Arizona anti-inflammatory food pyramid is the inclusion of Asian mushrooms. We know that Asian mushrooms contain certain polysaccharides, a beta-D glucan wall, that are truly immunostimulatory, meaning that they promote good immune health and potentially promote immune surveillance against cancer cells. Within this diet pyramid, we're really looking for not only the inclusion of omega-3 fatty acids, but also to really look at what is the omega-3 to omega-6 ratio within your diet. So you're really trying to consume a high number of omega-3s, which is cold, water, fatty fish, and then to really offset that with those that are known to be omega-6 heavy, such as lots of poultry, red meat, etc., particularly those that are not grass-fed. And so it's not just omega-3s, but it's also looking at the ratio of the two. We also use some information that we have gained by studying what are the components within some of these fantastic fruits and vegetables. For example, sulforaphane, which is found in cruciferous vegetables, such as broccoli, is an activator of antioxidant proteins. And here at the University of Arizona, we're actually studying an extract of broccoli as a potent chemopreventative for head and neck cancer. We also know that food can actually modulate our genes. And so some foods can actually inhibit the tumor promoter genes and upregulate suppressor genes. So there's this very potent food gene diet interactions that we're learning more and more about every day. We know that curcumin, cruciferous vegetables, soy, resveratrol in grapes, garlic, all of these will have this food gene diet interaction. So lots that we can do within the diet to really promote our health and wellness. So many of you may be asking, well, what about the neutropenic diet, right? My ANC is less than 1, maybe less than 500. And I was told by my team to not eat any raw fruits or vegetables. And I run into that a lot, particularly in the transplant setting. And I do want to share that there was a very nice meta-analysis of the randomized controlled trials out there. And this was published in the American Journal of Clinical Oncology in 2019. And they looked at 5 randomized controlled trials of 388 patients, AML, ALL, and interestingly, sarcoma, because they're very myelosuppressive regimens. And the infection rates were 53.7 in the neutropenic diet group and 50% in the unrestricted. And so the authors of this meta-analysis concluded that there truly was no significant difference in between neutropenic diet and unrestricted diet, meaning the consumption of fruits and vegetables. So truly more studies are needed for this to answer this question. But in my own practice, at least, I do not limit fruits and vegetables. I do advise that they wash them carefully, but the consumption of raw fruits and vegetables are occurring in our neutropenic patients here and even on our transplant floor during periods of ANC of 0. What about this concept of the microbiome? And many of you have likely heard about the microbiome, which is the balance of the good and the bad bacteria in our gut. And that we really have this gut-brain axis and this gut-brain immune system axis, where all of this is really impacting so much of your cancer response, your side effects, your mood, your sleep. And so we're learning more and more about the microbiome. And I would say that we honestly have more questions than we do answers, and it looks to be disease specific. But if you take all of the studies together, most are pointing towards what we're looking for, and this is really kind of common sense almost, is a diversity. You don't want just a population of this or a population of that, but you want a nice, diverse microbiome. But there certainly are some species that tend to be associated with better outcomes. And so here is a really nice review article talking about that. But what I take away from that is, no, we are not at a space where we say, you need to take this particular bacterium to populate your microbiome. We're in a space of how do we promote diversity? How do you do that? And so this is really just good common sense, again, is looking at good, clean nutrition, plentiful fruits and vegetables, particularly some items such as our root vegetables, the leeks, onions, but also asparagus, broccoli, artichokes, plentiful greens, really help to promote the microbiome diversity. This is like food for the microbiome. We know that sugar and processed foods lead to less diversity and a microbiome populated with those less beneficial organisms. You can also supplement with some of these pre and probiotic foods such as yogurt, kefir, sauerkraut, miso, kombucha. You're looking for a very high fiber and a high diversity of foods that you're choosing. And I always say, eat the rainbow, meaning at every plate that you sit down, you should try to have as much color as possible. Can you literally get all the colors of the rainbow in one plate? Whole grains are important. And then just good sleep, exercise, reducing stress, all of this together truly impacts the microbiome. There's also some thoughts that you may have heard this term of leaky gut, that the leaky gut can help to be modulated by the inclusion of certain dietary foods such as collagen that can be found in bone broth, gelatin. And then often I get the question of probiotic supplementation, not just via foods, but what about the pill that you can take and you can get at the grocery store or the supplement store? And there's been some controversy here. And what I would say is that at least with a long-term probiotic supplementation course, it appears that the diversity actually gets limited, is smaller. And so my own practice with the hematologic patient population is to focus on repair, which can be through collagen, gelatin, this healthy diet, feeding the gut bugs, but also having a short course of probiotics, somewhere in the range of 2 to 4 weeks, and then to stop. And then just to focus on, again, feeding with a healthy diet and to really focus on the sleep cycles, the stress cycles, all of that to maintain that healthy microbiome. And then if there are times of which there has been some microbiome stress, such as a transplant, such as a course of antibiotics or a colonoscopy, for example, then maybe we go back to that repair, re-inoculate with probiotics, and then maintenance again. So that's kind of my anecdotal practice in the clinic. We certainly need more data for this. What about physical activity? We know that physical activity is extremely important to help decrease inflammation, obesity, which is also inherently linked to inflammation and stress. So these are the American Cancer Society recommendations, and that's 150 to 300 minutes of moderate intensity or 75 to 150 minutes of vigorous intensity exercise per week. I like this meta-analysis that was performed in breast cancer because it really breaks it out that all intensity exercise is not created equal. And what we really need is some cardiovascular, some strength, and some flexibility. And so I often will counsel patients to really evaluate what are the activities that you can do, B, enjoy and can sustain, and see how can we diversify that to hit all of these different domains: cardiovascular, strength, and flexibility. It's interesting, if you look at the data for breast cancer, there's a sweet spot that you can underdo it, but you can also overdo it with exercise. And that is different than what we see, say, for example, in colon cancer. So it appears that with each disease state, there's truly an exercise prescription, and we have yet to define that in our hematologic population. And in particular, I've looked at the myeloproliferative neoplasm population, but the same is true for aplastic anemia, MDS, and acute myeloid leukemia. There's a delay. So this is one of the studies I had the opportunity to work on with Mayo Clinic, as well as Arizona State University with Ruben Mesa, as well as Jennifer Huberty. And we looked at yoga in those afflicted with myeloproliferative neoplasms. And we had 62 patients enrolled, and 48 completed their intervention. And they averaged a very nominal or little amount of yoga per week, 40 minutes per week of yoga. But we found that there truly was a significant impact on their inflammation. There was a decrease in their tumor necrosis factor alpha from baseline to week 12. There was also a small to moderate, what we call in some statistical terms, effect sizes for sleep disturbance, so some sleep improvement, pain intensity, decreased pain, and decreased anxiety and depression, with, again, very small amount of commitment for yoga over the week. So I think there's truly a lot of benefits to not only yoga, but all the forms of meditative movement. And that includes Tai Chi and Qigong as well. And then I think that's because we're really hitting many domains of wellness. We're engaging the breath when we participate. We're engaging and moving the body, and we're quieting the mind. And so I think there's lots to be offered with meditative movement, and certainly would encourage your exploration and participation in some of these modalities, because they can also be very attainable. These modalities can actually be performed in a chair or lying in a bed. And in fact, I have a clinical trial in multiple myeloma looking at Tai Chi during transplant. So when patients are even at their sickest in the hospital, they're still able to perform some of the Tai Chi movements. And this is one of the resources I really like. I use this modality in my clinical trials, and it's very easy. I taught this Tai Chi easy when I was 9 months pregnant and could not see my toes, literally. And I still was able to do these movements and teach our transplant patients on how to perform these movements. So I would encourage you to, again, explore with, even if this is completely a new idea for you, to explore what would Tai Chi feel like, or yoga, Qigong. And again, it's also good to learn a new skill. And so maybe that this could be something fun to try with somebody in your family or a friend. There's a website here, but also this book is phenomenal. And it teaches you not only about Tai Chi, but massage, meditation, and breathing. So all these modalities together. So, really, we've been focusing our conversation so far on body and lifestyle medicine. And I'd like to shift to the right hand, to the mind and stress reduction. And we know that wellness of the mind is so integrally related to inflammation. And we've already discussed how inflammation is something we are very much trying to modulate for cancer propagation, its initiation, but also potentially to help with your side effects and your quality of life. This was a nice review back in 2006, and I keep using this slide because I haven't seen such a review that could really displace this really fantastic one that talks about what happens in the stress response in our bodies to the tumor microenvironment, to cancer cells and the environment around those cancer cells. So we know that through cortisol, noradrenaline, and adrenaline, all of these stress hormones that are released day in and day out in our Western society, that it's again impacting that microenvironment. And how is it impacting it? Well, that's through impacts on the immune system. We know that immune cells are dampened. There are less of them being called to mobilize to that area. They're not only less of them, but they are less robust, meaning they are not mobilizing quickly. They're moving slowly. Cancer cells, on the flip side, are really stimulated. They're migrating, they're invading other tissues. They're upregulating proteases, which are enzymes that are breaking down proteins to allow them to migrate. The DNA repair mechanisms are altered in stressed environments. We know that viruses, like cancer cells, are also really happy in stressed environments. They are increasing their oncogene transcriptions, their viral replications, and their host cell cycling, so more and more active. We also know that blood vessels are growing more rapidly. We call that process angiogenesis. And we can measure that with different protein expressions and cytokine expressions, such as IL-6, of how many blood vessels are in an environment. And we actually know that that's one of the ways cancer cells grow is through increased angiogenesis or blood vessel growth. And we actually have cancer agents, anti-cancer agents, that block this mechanism as a therapeutic, particularly for colon cancer, brain cancer, kidney cancers. So this is really important. So we can see that stress is so impactful in this tumor microenvironment. So what do we need to do first? We need to recognize stress. We need to be aware when we're holding on to it, because we can't intervene unless we first see it's there. And so I wrote this stress inventory, and it's really just a check-in. And I recommend that you do this many times per day, and it literally takes 2 seconds, but you kind of say, where am I in my mind? Am I in the present, engaging with my breath and having nurturing self-talk, which is more of an anti-inflammatory, relaxed state? Or am I in the stressed response? Am I worrying about the future or ruminating about the past or planning, perpetual planning loops, or engaging in negative self-talk? And that's more of that stressed kind of pro-inflammatory mind state. So being aware, where is your mind? And then also being aware, where is your body? Are you engaging in deep, slow belly breaths with relaxed posture and muscles, with warm hands? Or are you tense, protracted, with shallow breathing, with cold, clammy hands? And that's that stress state. So again, focusing on where you are many times throughout the day. And now we have smartphones and watches that can give us little check-ins of, right, where are we? And then when you identify it, it's so important to then have a mechanism to release. And so perhaps we can spend a couple of moments doing this together. And this is called the 4-7-8 breathing technique. And this is from Dr. Andrew Weil, but it's honestly based on ancient yogic practices, Indian practices. So first of all, go ahead and close your eyes. We'll do this together, relaxing your shoulder, again, getting into that relaxed body posture. And just begin engaging your breath in and out. Non-judgmentally, just kind of seeing where you are, checking in. And you can put your tongue, the tip of your tongue on the roof of your mouth. Breathe in through your nose and out through your mouth. I'd like you to breathe in deeply for the count of 4. And I want you to hold that for the count to 7. 5, 6, 7, and breathe out fully and intentionally for the count of 8. You'll notice you'll really have to take a deep breath in for that. So again, breathing in for 4, holding for 7, 2, 3, 4, 5, 6, 7, and out for 8. 2, 3, 4, 5, 6, 7, 8. Again, breathing in for 4, holding for 7, 4, 5, 6, 7, 8, and out for 8. And go ahead and do that 2 more times. Just breathing in for 4, holding for 7, and out for 8. Breathing in again for 4, holding for 7, and out for 8. And you can open your eyes and rejoin, and you can already feel how that instantly relaxes you. And so it's a wonderful tool, and I often recommend that that's how you start the day, engaging in that breath and that relaxed state, and then end the day doing 4 cycles of that 4, 7, 8 breathing. And then any time that there's a stress response that you recognize, whether it be via the inventory that I shared in the last slide or through other mechanisms, a stressful phone call, perhaps driving or checking into a cancer center and your appointment's delayed or your labs are delayed or whatever it is, engaging that 4, 7, 8 breathing during that time. And like a muscle, the more that you practice it, the stronger it becomes. So it really needs to be a practice. And then that tool is as sharp as it possibly can when you actually need it. I've had patients that were chronically on benzodiazepines, things like Valium or clonazepam, that have successfully gotten off through this breathing mechanism alone. But that's one tool. There are many, many other meditation applications out there that you can utilize. Headspace, Calm, Insight Timer. These are all potential applications that can help you on your meditation journey, and you can actually change over time and utilize and create new skills. And so I highly recommend that you experiment and see what really works for you. Here are a few other resources. Mindfulness-based cancer recovery is a fantastic book, and mindfulness is different than meditation alone. It's a specific kind of meditation, and it's really about being in the present moment, non-judgmentally. And it really has a ton of evidence around how it can improve your symptoms and your quality of life. So I encourage you to either individually within your family or within a group at the cancer center, engage in some mindfulness training, because it really can shift your perspective and your quality of life. So what about fostering joy? And this may sound crazy in the midst of a pandemic, amidst cancer, to foster joy. And many have actually told me that cancer was the best thing that ever happened to them because it does have the capacity to shift us, right? To focus on what it is in your life that is so, so important. And joy is one aspect of that. And so I like to assign two different homework assignments in this category, one of which is a daily joyful intention where you name something joyful, and that can be hard at the beginning. And so sometimes we have to journal and explore and try to find what are some of those joyful activities. But name the joyful intention, do it at least 10 minutes a day, but it could be much, much longer. And then reflect back and have gratitude on those moments of joy and do that every day. And then greeting the day with gratitude. So before even stepping out of bed, thinking about what is it that you're grateful for? And the challenge here is to not always focus on the same things, the same three things, but the day prior, maybe this is before bed or whenever it works in your day, but the day prior, what was it that brought you gratitude? And change it up, try to expand the bubble for new avenues of gratitude. And the more that we're able to look back and retrospectively identify them, the greater capacity we then develop to recognize those moments in real time and to have gratitude and appreciation for the little things throughout the day and to start really being in the moment. I love this quote. I have something blocking the whole thing to read it. Let me move that. Okay, joy is far less vulnerable than happiness. Joy seems to be a part of the unconditional wish to live, not holding back because our life may not meet our preferences and expectations. Joy seems to be a function of the willingness to accept the whole and to show up to meet whatever is there. And so that's from Rachel Naomi Remen from Kitchen Table Wisdom, which is a really phenomenal book. What about finding meaning and connection? And this is different for each and every one of us of how do we do this within ourselves. And some it's within community. Some of us, it's within spirituality and religion. And some of us, it's through connection of the natural world and nature and beauty. And so another homework assignment I assign, patients leave my clinic with lots of homework, is a 10-minute daily practice of something that connects you to one of these pillars, community, spirituality, or nature. Because we know that for those that have a connection with something outside of themselves, do better. And what I mean by do better means that they are having better cancer outcomes, less side effects, less disruption of sleep, and less depression and anxiety. So it's really potent medicine to be moving in this space of finding meaning and connection every day intentionally. And so we've been really working our way around the pillars, right? Body, mind, joy, meaning. And as you can see, there's complementary modalities kind of speckled around the outskirts. And that's really how I view integrative medicine is it's again, conventional medicine, all of this wonderful lifestyle medicine. And then we can speckle in some of these complementary modalities. And boy, are there a slew of them. We have so many choices of things that can augment potentially our care. Acupuncture, naturopathic care, Chinese medicine. We talked about meditation, Ayurveda, hypnosis, Native American healing and prayer lodge, biofeedback, essential oils, homeopathy. We can just go on. And the truth is that most of you are likely doing something on the complementary care modality list. Our surveys show anywhere from 40 to 60% of cancer patients are already utilizing some complementary modalities. One of my favorite is acupuncture. We know the acupuncture based on the NCI's Institute Conference on Acupuncture for Symptom Management and Oncology, we know from that symposia and from the collection of research from those experts that it's effective for some indications and certainly safe. The best data is for pain and nausea. It can be effective for sleep, fatigue, particularly smoking cessation. And so I usually recommend for patients that are open to this is to give it a trial of at least a weekly dose or session for a month or two, and to see if there's any improvement in the symptoms. What about botanical medicine? And I tell you, we could certainly spend an entire 3-day symposium talking just about botanical medicine in and of itself. So I am not going to delve into particular botanicals, but I would like to really leave you with some robust resources. And so one of my favorites is the Natural Medicines Database. What I like about this, although it really is a subscription, so you have to pay for access to this, or your doctor will have to pay access for this. You can get it as well. But you can put your chemotherapeutic or your all of your medicines really, and then the botanicals that you're interested in, and ensure that there's no drug interactions based on the current literature that we have available. You can also go through and there's an efficacy finder, and you can search by disease of what are some of the higher quality botanicals that have some research, and start to investigate if there are botanicals that can help either with symptom management or with disease outcomes. Also, Memorial Sloan's Kettering Cancer About Herbs has both an app and a website, which you can go on and do something similar, but lots of good information there. Of course, I need to caution you with the issues of botanicals that there's potential for source and contamination issues. Pharmacologic interaction is one of the highest concerns, particularly those on chemotherapeutic regimens with curative intent. Safety, bioavailability, meaning are you actually absorbing it? And then there's difficulty with studying these botanicals. All sources are not the same. It's hard to find funding for this. And so we still have a long way to go for having robust randomized phase 3 data for botanical medicine. So my approach is really, as much as possible, to use food as medicine. We know that by isolating, for example, sulforaphane from the broccoli plant, you can isolate that compound, but there's so many other things within the broccoli, indole 3-carbinols and others, flavonoids and things that all work synergistically. So by isolating one component, you're really losing the beauty of nature and plant medicine. And so that's why I like this picture of a clear capsule just stuffed to the brim with food, because that is the beauty of plant medicine. Nutritional science is eating whole foods. If you are taking supplements, I encourage you to ensure that they are very high quality. And here are a few stamps of approval that are assured that they have gone through a quality assurance process. USP, Consumer Laboratory CL, as well as NSF are nice quality stamps of approval. I will caution you that there are many other stamps out there on the back of supplement labels that are fake stamps. Not that they have USP, CL, or NSF, but they have other stamps of approval which are not high quality. So be aware of that. So a few years ago, in collaboration with Mayo Clinic, I did a study looking at what are the integrative medicine modalities used in myeloproliferative neoplasm patients across the world. And this was 52 countries that participated in this. And we had almost 900 patients. And what we found is that there was a broad spectrum of integrative therapies being used. Many were using natural products. And this is what was so scary. And what I want to highlight is that 20% reported not disclosing their supplement use to physicians. And so I would say that two major take-home points of that study was A, there's a high need for integrative education and research, but B, and most importantly, that there's this high need to communicate supplement utilization with your hematologic care team. And so I really hope that you hear that today and take that home, and certainly have some transparency with your care team. So we talked about body, mind, joy, meaning, complementary modalities. And again, you have now some tools in your tool belt to help really promote your own wellness. It's not just compliance with your medication and showing up for your laboratories, but there are other things that you can do that potentially will affect your disease outcomes, but also make you feel better. And so while we're wrapping things up today, and I hope you have a pen or a pencil and a piece of paper, but I'd like for you to spend a few moments just thinking about 3 of your own wellness goals for yourself. Thinking about everything we talked about: diet, exercise, meditation, breathing, maybe some complementary modality that you've wanted to try and haven't yet. And set 3 goals for yourself that you're going to do over the next couple of weeks. If you don't have pen and paper, maybe use Microsoft Word on your computer or your cell phone. But actually take the moment to actually write this down. And one of the other points to consider is that now you have set these 3 wellness goals for yourself. How are you going to really hold yourself accountable for these goals? Is there a friend you're going to engage? Are you going to say it out loud to your friends and family? Are you going to put some sticky notes up in the house to remind yourself? Maybe a reminder in your phone. A whiteboard can be nice to set up. A journal. Some way that you're also going to promise you're going to keep yourself accountable to some of these goals. One way is to really look at some of the applications that are out there. And so this is one in which I worked with on myeloproliferative neoplasm patients, where we asked them to make some goals and to see how it's impacting their lifestyle, but also their symptom burden. And it was a small pilot. We had 30 patients, but there was a signal for impacts on their symptoms. So we'll be studying this more. But this is just kind of a planting a seed that there are many applications and resources out there that can help you as you start making these goals for yourself and making a commitment to promote your own wellness. This is free on the App Store, by the way. So I'd like to end by thanking the MPN Quality of Life Study Group, for which we are doing many non-pharmacologic things. I wanted to do this last take-home points. Discuss your treatment plan with your providers. Eat intentionally, mindfully, with lots of color. To move often and breathe. To manage stress and cultivate joy. These are all the ways in which you can really promote your own wellness. So I want to say thank you again to the Aplastic Anemia MDS International Foundation for the sponsorship of this wonderful opportunity for us to come together and discuss this important modality.
You so much. And we have some questions that have come in. So I'll start with our first question. It is, what can a patient do to reduce side effects from hand tremors that impede even holding a spoon? Do you have any tips that may be helpful for that?
Hand tremors, I think that's an interesting one. I haven't run into that one before, but I would think that the key is to think about what is the physiology that's driving that, right? Is that an intentional tremor that's physiologic? And sometimes we use propranolol for that. Is that a post-transplantation medication-induced tremor from something like high cyclosporin or tacrolimus? So I think the key is to really understand what's driving the tremors. And I can't think besides maybe mindfulness, deep breathing, visualization, but there's no quick fix for tremors.
Thank you. Our next question says, my son-in-law's doctor has told him not to eat raw vegetables or fruits because of the risk of infection. That is a major food group in the Mediterranean diet. Any suggestions on how to work around that?
I think number one is to have a conversation with the doctor again. I had mentioned that there was a recent meta-analysis that was done in 2019 that actually showed that there was no efficacy of the neutropenic diet. And so I think number one is a conversation. Sometimes we just revert to old recommendations or printed out. That's kind of been the dogma for many, many decades, but maybe that can be discussed and really modulated. But if they really are feeling strong about that, I think some strategies are to really cook the foods, right? So usually it's the raw. And so when you actually wash your vegetables and cook them, they no longer can harbor those pathogenic organisms. And so soups is one of my favorites. I often recommend starting with some bone broth because it has that collagen in there, again, healthy for that leaky gut. But then you can really put, everything in there. We call it the Holy Trinity in cooking. I love to cook onions, celery, garlic, carrots, and then you can just put sweet potatoes and kale and zucchini, and I just pack in and tons of shiitake mushrooms or maitake mushrooms, again, for that really immune benefits. So soups, I can't say enough about soups. I think soups are wonderful. You can make a big batch on Sunday afternoons and then put them in the fridge for the rest of the week.
Thank you. Our next question, it's regarding the exercise. How can a patient engage in exercise when they feel lightheaded all of the time, or when their counts are low and they can barely even just get up to walk?
Yeah, it is a challenge. And I think you have to take it day by day. Certainly, there's going to be some days you can do more than others. Recognizing that some movement is better than none. And so, going back to some of our conversation around things like yoga, chair yoga, or even bed yoga, Tai Chi as well. In fact, particularly for those periods of deep neutropenia post chemotherapy, we're looking at the impacts of Tai Chi on the immune system. And there's significant data to support that Tai Chi is actually impacting the immune system. So that'd be a wonderful modality to do seated in a chair. Walking, certainly, but if you're feeling dizzy, then that's not a great modality. So they have the little hand pumps that you can do, or seated cycling. The first thing we need to be sure is that it's safe, right? And so if you're feeling dizzy or wobbly, then you really need to come up with some ways to get moving that can be done in the safety of a chair. So hand weights, simple hand weights, again, focusing on the strength can be very beneficial. And some simple stretching, even chair stretching, can be helpful. So I would say overall, checking in, where are you at that day? What can you really achieve? Are there small things that can be achieved that day? And then to escalate as your body is ready to other modalities.
Thank you. What are your thoughts about chair yoga?
I love chair yoga. And so I think again that what meditative movement really has to offer is just it's beyond what the actual physical movements are, right? It's engaging the breath, it's quieting the mind, and then it's also expansion of the rib cage. It's deep breaths that is expanding the lungs, and so you're getting all of these other physiological benefits besides just, the quote unquote exercise that you would typically be getting from a chair yoga. So yes, chair yoga is wonderful. I would recommend. There's plenty of YouTube videos out there. I would highly recommend it.
Thank you. Our next question is, what is the recommended dosage of probiotics during the short course time frame?
Yeah, we don't know is the honest truth, but a universal kind of dose is 25 billion. That would be a place to start. And high quality supplements are sold often at that 25 billion mark for 2 to 4 weeks. So 25 billion daily.
Thank you so much. Do you have any suggestions regarding exercise for a patient with MDS who also has a pacemaker?
Well, I think again, letting your body be your guide. If you're having chest pain, shortness of breath, palpitations, that activity is not for you. But in general, a pacemaker is not meant to limit activity. And so I think, whatever activity, as long as it's discussed with cardiology, you want your cardiologist buy-in. You want to be sure that your arrhythmia is well controlled, that you're not having periods of syncope or passing out. These are warning signs. So certainly, be sure you're in your best health, you're communicating with your team, but then otherwise, just again, listening to your body and what you're able to do. Again, focusing on some element of aerobic, some element of strength, and some element of flexibility is really getting all the multi-dimensional benefits that can be offered through exercise.
Thank you. Our next question is, how important is it to eat organic fruits and vegetables? They can be very expensive.
Absolutely, they can. So there's something to consider is the dirty dozen and the clean 15. And so the dirty dozen are those fruits and vegetables that we know are harboring the most pesticides in our grocery stores. And the clean 15 are those that have the least. So if you're trying to eat organic on a budget, I would recommend starting there. But we do know that, herbicides, pesticides are carcinogenic, and often organic vegetables have a higher concentration of some of the phytonutrients. And so I do recommend eating organic if you can afford it, but certainly trying to pick off the dirty dozen, clean 15, like pick your list smartly at the grocery store.
Thank you. Our next question says, isolation has been very difficult and depressing. What is your opinion about asking family and friends into our home if they are asymptomatic and about wearing an N95 mask? My husband has high risk MDS and is dangerously immunocompromised.
I know this is such a hard question. I struggle in my own clinic with. There's no blanket answer. And I think the conversation is also with with your hematologist, his hematologist, to better understand his immune compromised status and goals to make a really educated decision. But ultimately, it's a risk tolerance. And so obviously, if it's different, if COVID-19 vaccinated and boosted, and we now even have monoclonal antibodies such as Evusheld out there for the hematologic patient population, for which many of my patients have received. And so for them, they started feeling a little bit more free, right? They're boosted, they have the monoclonal, rates are going down, but there's no right answer. And I would say that we do know that those infected with COVID with concurrent hematologic disease have poorer outcomes and a higher risk of death. And so we do have to think about that and really be evaluating our choices in the most personalized way possible.
Thank you. How does a patient go about finding an integrative physician to be able to be part of their team to help out with their treatment and their living well beyond diagnosis and treatment?
I think it depends on where you live. If you're in a large city, there's likely a large academic center that likely will have some robust resources, including an integrative oncologist and an integrative oncology care team. In smaller areas, it can be more of a challenge. I will say one of the nice outcomes of our COVID pandemic is that there's more and more telemedicine. And so potentially an integrative medicine and more specifically an integrative oncology care provider may be able to be located via telemedicine. For naturopathic care, there's more and more trainees that are really focused on oncology care, and you can identify them by the letters FABNO, FABNO, after their education. So if you do see a naturopathic physician, you really want to find an oncology educated one. So that's a FABNO. You can go to the Andrew Weil Center of Integrative Medicine website, and there's a place that says locate a provider. And you can input what you're looking for and your location, and it will actually help you find a provider.
Thank you so much. Any other tips that you can think of to help folks with diet or mindfulness or anything, any other suggestions that you may have?
Mhm. Well, I think the biggest key is that to make this work, you really need a community around you, right? And so engaging your family, and if it's not your family, friends, or somebody that you know at the cancer center, but you're going to need a team around you to make these major changes. I often don't recommend that you make all the changes at once. So again, we had picked three goals, right? So try to pick three goals that seem doable for you to start with. And then that momentum is then propagated by that success, right? So you want to start small, make your goals reasonable, and then start expanding and doing more and more, but not to make, I'm going to overhaul my diet. I'm going to exercise times a week. I'm going to meditate for an hour a day. Like if you make it a giant undertaking, it becomes undoable. So you really have to be thinking about how to piecemeal this out, how to really lay the carpet out in a way that you can really kind of walk forward down the path and add more as you go. So I would definitely recommend that. I love the applications for meditation that I had put on the slides. My personal favorite, I probably shouldn't say personal favorites, but I do like Insight Timer. It's one of my favorites. I think prep cooking is another key, right? And so it can be overwhelming to cook. And so smoothies, I love to make smoothies, put tons of fruits and veggies, and you can actually put a lot of veggies. I torture my children with this, putting things like cauliflower, frozen cauliflower and cucumbers and celery in their smoothies, and they hardly taste it. So you can make a big batch of smoothie and then put them into the popsicle molds and freeze it. And that way you can have it all week long without the burden of making smoothies. And the same idea with the soups. Overnight oats in little mason jars can be nice as well. So think about prep cooking, getting people to help you with prep cooking once per week can really help with nutritional goals.
Thank you. And there was a question here about the slides. Someone was having difficulty with seeing the slides. So if you can just send me an email, my email address is clark@aamds.org, and I'm happy to make sure that you get the slides so you can see those. So thank you so much, Dr. Gowin, for sharing your time and your expertise with all of us today. And if you'd like to watch the session again at a later time, it will be available on the conference platform within the next hour. You can access the session and just click replay, or you can also find it navigating the on-demand tab in the platform hub. If you have any additional questions, you can send it to us at any time within 3 ways. Send an email to our help account, which is help@aamds.org. Call our helpline 800-747-2820, extension 2, or submit your question to our Facebook page. Please do take a few minutes to complete the surveys, the session survey. Your input is very important to us and does help us plan our future educational programming. Remember, there's still time for you to visit the exhibit booths. And if you're interested in the support groups, they'll start in approximately 15 to 20 minutes. On behalf of the Aplastic Anemia and MDS International Foundation, thank you for joining us today, making us your resource of choice for information on bone marrow failure diseases. Our medical advisory board and team are always here to support you and your family, as we've done for the past 38 years. This concludes our session.